The thing we're most proud of is the fact that we do have an APIN grant, and we are actively working with this New Mexico Nursing Education Consortium to improve access for baccalaureate education with an ultimate goal of increasing baccalaureate-prepared nurses for the state. And then the long-term goals would be increasing diversity in our workforce, as well as increasing the number of graduate-prepared nurses in New Mexico. Now, the reason that that's really important is because if we have more baccalaureate-prepared nurses, that means there's a larger pool of nurses who are able to go on for their master's or doctoral degrees. And as everyone knows, we're going to need to have more advanced practice nurses available for our rural communities, primarily for primary care, and we need more nursing faculty. So in New Mexico, we have a very diverse population, and unfortunately, many of these diverse populations have undermet or underserved needs as it relates to health care. One of our long-term goals for our Action Coalition is to be able to provide better health care access to those diverse populations. And again, one of the ways that we hope to do that is increasing the number of nurse practitioners, primary care providers in the rural communities to meet their needs. So in New Mexico, because we have a very rural state, we have a real priority for increasing the number of primary care providers. So our New Mexico Action Coalition really is committed to not only enhancing the nurse practitioner scope of practice, but also to long-term provide opportunities for nurses to become nurse practitioners, particularly at the DNP level. So I would say probably of all things in terms of making a difference for long-term outcomes of care, that would be one of the most crucial ones because we are a rural state. Now, states that are more urban may not have quite the same level of urgency in this area, but in New Mexico, it's really less, maybe I should say it's not so much rural, it's really frontier in many cases. And because we're so large and such a small population, people can literally live miles and miles away from a nurse or any provider. So this is a really crucial area of work that we have to do.